Hi, I'm Professor Emily Mercuri, and today we are covering Chapter 4, Medication Preparations and Supplies in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to 1. Differentiate between various oral and rectal drug forms. 2. Describe the various injectable drug forms. 3. Define the following types of injections: intravenous, IV, intramuscular, IM, and intradermal, ID. 4. Explain how the different type of injections differ in administration and absorption. 5. Compare the IV injections referred to as IV push, IV infusion, and IV piggyback. 6. Contrast the various topical drug forms. 7. Explain the advantages of administering drugs via a transdermal patch. 8. Describe inhalable drug forms. 9. Identify various supplies used in the preparation of medications. As a reminder, if you are ever wondering where you need to focus your attention, the chapter objectives slide is a great slide to come back to and just make sure that you feel you have an understanding of all of these topics. As we learned in Chapter 3, drugs may be administered through the gastrointestinal, GI tract, or the parenteral route. So GI tract administration routes include oral, nasal gastric, so in the they'll place like a tube that goes from your nose down into your stomach, or gastrostomy tubes, which go directly into the abdominal wall itself, into the stomach, and rectal. So those are all within that GI tract route. And then parenteral administration refers to those that do not involve the GI tract. So they bypass that altogether. And these include injections, topical, transdermal, and inhalation routes. We're going to go over each of these in more detail so it will start to make more sense as we go along. The ways in which drugs are prepared is just as extensive as the routes in which they are given. Drug form refers to the type of preparation in which the drug is supplied. The route of delivery provides guidance on how the medication is most suitable for what it is intended and the most appropriate means of absorption. So those are two terms I want you to be familiar with. Drug form refers to the type of preparation. For instance, you could take a medication orally. As you all know, sometimes you drink like a liquid cough medicine, or sometimes you take a Tylenol, that's a pill. So the form of the drug is different, but the route of delivery is still oral. So those are two terms I want you to be able to differentiate between. So there are some pictures on this slide, and these show you the drug administration routes, including oral, rectal, injectable, topical, implantable, and inhalation routes. And you'll see that within those routes there are different kind of subcategories, and we'll go into that on these slides that are coming up. So first we're going to talk about some different oral drug forms. One is tablets. So tablets are discs of compressed drug. They come in a variety of shapes and colors and may be coated to enhance easy swallowing or scored, allowing the tablet to be cut. Remember, scoring just refers to a line that's in the center of the tablet, or sometimes there are medications that they have two scoring lines, so they are broken into threes. And those are important because they allow for easy cutting or breaking of the tablet with a controlled amount of the substance still. Enteric coated contains special coating that resists disintegration by gastric juices. So the coating dissolves further down in the GI tract, and to be effective, the coating must never be destroyed by chewing or crushing when administered. So essentially, these medications, in order for them to be delivered in a way that they get the best absorption, they have to go through the stomach and be digested later on and metabolized later on in the GI tract. So if you ever have a patient who has this kind of medication, like it says, we just don't want to let them chew it. We want to make sure if they have swallowing difficulties and they are on orders to have their pills crushed, we can't give an enteric-coated pill crushed because it's essentially taking away its ability to work the way that it's supposed to if it cannot bypass the stomach. Capsule is another oral drug form. Capsule is a drug that is contained within a gelatin-type container. Sometimes they have gelatin-free ones. For vegan patients, you can usually find a gelatin-free type of option. But capsules are easier to swallow, and if needed, the double chambers can be pulled apart to add the drug powder to soft foods or beverages for ease of patient administration. So it's important to differentiate because capsules can be pulled apart and the contents can be sprinkled onto something like into applesauce, something like that. But there is also something called a sustained release capsule or sustained release tablet. And these contain drug particles with different coatings. And this form of drug is designed to deliver a dose over an extended period of time. So if you have a sustained release capsule, those are not to be opened and poured into anything. So it's basically this capsule with these little tiny, almost look like little tiny beads inside of it. And each of those is a sustained release little capsule within the bigger capsule. And so it is going to affect absorption if we open those up. So capsules can be opened and sprinkled. Sustained release capsules are not to be opened or sprinkled. Another type of oral drug form is a lozenge. A lozenge is a tablet with a palatable flavoring to provide a soothing effect on the throat or mouth. Patients should not swallow the lozenge and should allow it to slowly dissolve in their mouth. They are also advised to not drink liquids for approximately 15 minutes after administering to prevent washing off the contents in the throat or mouth. So for lozenge, think of a cough drop, but there are versions of that are medicated for various reasons. And it's going to kind of provide this coating in your mouth and down your throat that if you drink water, it will wash it away. So we want to give that time to sit. Suspension is another form, and suspension is a drug in liquid form that must be shaken before being administered due to drug particles settling at the bottom of the bottle. Flavoring of the suspension is common as many tend to have a bitter taste as a result of being suspended in liquid rather than dissolved. For this, I think of the pink amoxicillin that oftentimes is given to kids. It's like a pink bottle, you shake it up, and they usually add like a bubble gum or fruity type of flavor to make it more palatable because, again, that medication can be very bitter if it's not flavored. Another form is emulsion. Emulsion is a liquid drug that contains oils and fats in water. These are typically topical or transdermal for use, so it's rare that you would use an emulsion for an oral drug form, but it is possible. That's why it's under this one, and it can also be under the topical category. And then elixir is a fluid extract drug with an alcohol base. It should be tightly capped to prevent alcohol evaporation and should not be used with small children or individuals with an alcoholic diagnosis. Additionally to those, we also have syrup, which is a sweetened flavor liquid drug prescribed commonly for children. Liquid Tylenol, liquid ibuprofen, those are typically a little bit thicker, sticky, sweeter. And then a solution, which is a liquid form drug that is totally and evenly dissolved. The appearance is clear rather than cloudy or settled. Many orally administered drugs are available over the counter, meaning you can buy them without a prescription. The oral route is the easiest and found to be the most cost-effective for administration. It is, however, not the route of choice for treatment in emergencies, acute pain, patients with physician orders of nothing by mouth, or patients who are unable to swallow. Keep in mind that when we're talking about oral drugs, they also are going to take some time to work. So if you have a headache and you take Tylenol, it could be 45 minutes before you're going to start to feel relief. And so it's also not the most rapid acting form of drugs, but again, it's very cost effective, it's easily tolerated by most people, and many times it's available over the counter. Rectal drug forms. The use of rectal drug administration is often the choice if a patient is ordered to be NPO, remember back to our other lecture, NPO, nil per oris, nothing by mouth, or cannot swallow. The following are utilized for this type of treatment. 1. Suppository. Suppository is a drug suspended in a substance that melts at body temperature, for example, suspended in cocoa butter. This is an effective route for individuals who are NPO and who do not have the ability to swallow properly. So an example of one that we give often in the emergency department is if somebody comes in and they have a high fever and they aren't able to swallow, or we don't know if they're safe to swallow, maybe they're really drowsy, and we have Tylenol in a suppository form. And so it comes in this kind of metallic foil type of case. You open it up and it looks like the shape almost of a bullet, but made out of some kind of something that can melt, but it looks almost like wax. It's not wax. It's more like cocoa butter or something that can safely melt. But you administer it rectally, and you kind of hold it in that spot until it dissolves, and then that medication is absorbed. And actually, rectal medication is absorbed very quickly due to the thin mucosa in the rectum. An enema is another rectal drug form that may be in a suspension or solution form and administered as an enema, so typically more of a liquid. And enemas are often used as preparation for a colonoscopy, where they're going to take a camera and look inside your intestines, or can be used in cases of severe constipation. The image here on this slide illustrates oral drug forms. Pictures A through D demonstrate tablet form medications. Pictures E through G demonstrate capsule medications, so you can see it's kind of that coating and it's in two parts. A lot of times they will be separate colors, and again, if it's not an extended release capsule, if it's a normal capsule, it can be opened. Picture H demonstrates a lozenge medication, and pictures I through L demonstrate different types of elixir medications that can be given in liquid forms. Knowledge check. The most common drug administration method for patients who are NPO, nothing by mouth, and cannot swallow is A, enteric-coated tablet, B, suppository, C, lozenge, or D, elixir. The answer is B, suppository. And just as a reminder, if someone cannot swallow, it's not safe to give a lozenge. Even though they're not swallowing it, they're supposed to be sucking on it, there is that risk that it would move backwards into the throat and cause them to choke or aspirate. Injectable drug forms. Subcutaneous is an injectable drug form, and it is injected into a fatty layer of tissue below the skin. So sub, below, cutaneous, skin. The needle is positioned at a 45-degree angle from the skin, and generally a 5/8 inch needle is utilized and is suggested for drugs that should not be absorbed as rapidly through the IV or IM routes. So IV and IM, which we're going to talk about next, those both absorb more rapidly. And 5/8 of an inch needle is a shorter needle, and then it's positioned at a 45-degree angle so that you're making sure you're not getting too deep, because we don't want that to get into the muscle layer or to be rapidly absorbed. Intradermal. So intradermal is generally used for allergy skin testing. And for this one, the needle is positioned just under the skin and bevel up using a 15-degree angle. So think even more shallow and even more towards the top layer of the skin. Due to the lack of vascularity in the dermis, absorption is low. And so the top layer of your skin doesn't have a lot of blood flow. And we don't want high absorption when we're doing like allergy skin testing, or if any of you have ever gotten your TB test, it's the same kind of thing. We just want to inject the allergen or the TB test right under the skin so that it's not being absorbed so much as it is showing if you're going to have a reaction to that thing. And then epidural, not typically used in an outpatient setting. Those who administer an epidural must be knowledgeable of epidural injections, and it's typically done by a physician, usually an anesthesiologist. And this route injects medication into a catheter that's been placed in the epidural space of the spinal cord. So as you can imagine, placing a catheter into the epidural space of the spinal cord is a very high-risk procedure. It's not something that's going to be done, just for the heck of it. It's going to be something that we're going to do in cases of needing that continuous pain control. The most common thing that it's used in is for childbirth. Less commonly used are intraosseous, which goes directly into the bone via a drill. The inside of the bone is very vascular. We use intraosseous sometimes in trauma. I'm actually trained to place them, but it is way more invasive and only used in emergency if we can't get an intravenous access. Intraventricular, which goes into the ventricle of the brain itself. intraspinal, and intracapsular injections. These are all parenteral routes that are usually limited to a physician's administration. The image below on this slide illustrates an intradermal injection, and you can see how it's just this very, very small angle of 10 to 15 degrees for the needle to go in. Okay, another form of injectable drugs is intravenous drug administration. So intravenous drug administration is conducted by directly injecting medication into a vein. IVs allow for immediate absorption and availability to major organs. IVs are usually administered by physicians, paramedics, and registered nurses. The different types of IV injections include, one, an IV push. So first let's talk about an IV itself. So it's a common misconception that the needle stays in your arm, but essentially you have a needle that is covered by a very thin catheter, and I think of that as like a tiny straw. So when the IV is being started, that is the needle, it punctures the vein, and then you, as the nurse or physician or paramedic who's inserting it, you carefully thread that needle in once you know that you're in. So you kind of push you push the catheter in, and then you pull the needle back. And so what's actually remaining in the vein is that little catheter. So I always tell patients it's like a little plastic straw that stays in your vein. So through that, you can give different types of IV injections, including an IV push. So an IV push is a small amount of a drug injected into a peripheral saline lock attached to a vein. It's also known as a bolus. So I am pulling up a small amount of a medication. That little catheter is attached to a short tubing, and I'm pushing it in the distal end of that tubing, and then it's going directly into the vein. 2, an IV infusion or an IV drip. This is a large volume of fluids, often with drugs added that infuse continually into a vein. So that's where you see like a bag hanging up above the patient. Sometimes it is the tubing goes into a machine that's carefully controlling the rate, or sometimes if we're giving fluids, it's just hanging with no machine. It's kind of wide open. We're just trying to get fluids on board. That would be an IV infusion or IV drip. And then lastly, IV piggyback. And this is when a drug is diluted in moderate volume of fluid for intermittent fusion at specified intervals. So an IV piggyback is a medication, let's say like an antibiotic, where I have a smaller bag and I am putting the medication into that small bag. It is hanging and it is going into that main IV infusion, but only maybe once every 6 hours for 30 minutes, and then that one stops and that main IV infusion kind of takes back over. Different types of injectable drug forms. Liquid is a drug suspended or dissolved in a sterile vehicle. Think of like a syringe. Often the solutions have a sterile water base and are referred to as aqueous or water-like solutions. Some solutions do have an oil base for prolonged absorption time, and those are what we would call more viscous, so they're a little bit thicker, and you have to be careful with those that you are making sure you flush well after, and you're just aware of your needle size and all those types of things. Powder is dry particles of drugs, and if you're going to inject anything, you're never going to inject something dry. So sometimes the drug comes in a powder form, and then you have to mix it with sterile diluting solution, usually normal saline. And that's known as reconstituting. So that word reconstitution of a drug, it means that you are making the drug into a form that can be used, making it into a liquid by adding something to that powder. Intravenous is injected directly into the vein, like those 3 routes we talked about before. A vein, if you think about it, a vein is bringing blood flow directly back into the lungs to be reoxygenated, then back into the heart to be pumped back out to the body. So it's a very immediate absorption. That process happens very fast, and then that medication's available to major organs very quickly. Intramuscular is an injection into the muscle where the needle is positioned at a 90-degree angle from the skin. Absorption is fairly rapid due to muscle vascularity, so muscles have a lot of blood flow. And generally, a 1-inch needle is used for an intramuscular injection. It's going to depend on the size of the patient and the size of the muscle you're injecting. And I think a good example of this is like when you get a vaccine. That's an intramuscular injection. So this image below illustrates intravenous administration. So you can see in A that there is a catheter in this person's arm, and there's a little short tubing off of that. And in A, they are giving an IV push. So they're putting that directly into the catheter, same as they are doing in B. Except for in B, you'll see there's a longer tubing, and so they are putting that into some fluids that are already running. And then down below on the left side, there is an IV solution bag. So that is an IV drip medication. And down next to that on the right, you see that smaller bag that hangs above. That's an IV piggyback. If you are giving an IV piggyback and it's hooked into the main fluids, whichever thing is hanging higher on the IV pole is the thing that's going to run first. That's just the way that the gravity of the system works. So if I want that medication to run in, I need to make sure that it's higher than the large bag that's below it. Knowledge check. Which are examples of injectable drug forms? A. Suspension, emulsion, and elixir. B. Suppository and enema. C. Transdermal patch, liniment, and ointment. D. Epidural, subcutaneous, and intramuscular. And the answer is D, epidural, subcutaneous, and intramuscular. Knowledge check. Injections into the fatty layer of tissue using a 5/8 needle at a 45-degree angle is A, subcutaneous, B, intradermal, C, intramuscular, and D, epidural. Your answer is A, subcutaneous. Remember that intradermal is going to be that very low angle of about 15 degrees. Intramuscular will be a longer needle, around an inch or longer, at a 90-degree angle. Epidural goes into the spinal space, so that is not done within the nursing scope of practice. And then subcutaneous is usually a 5/8 needle at a 45-degree angle. Knowledge check. Which injection is considered to absorb rapidly due to vascularity in the muscles? A. Intradermal, B. Subcutaneous, C. Epidural, D. Intramuscular. Kind of gave this one away with the phrase vascularity of the muscles. Your answer is D. Intramuscular. Knowledge check. IV push is also known as A. Infusion, B. Bolus, C. Piggyback, D. Drip. And your answer is B. Bolus. Infusion and drip refer to that larger bag, that kind of continuous IV line. Piggyback, remember, refers to something that's given in periods of time, maybe once every 6 hours, or just given over a short period of time, typically a smaller bag that hangs above the regular IV infusion. Okay, let's talk about the topical form of drugs. Here are some different types. So cream and ointment. Both creams and ointments are semi-solid preparations containing a drug for external application. Creams and ointments are not the same, and the dose used differs between them. So just something to be aware of. Creams are more aqueous in nature, meaning they're more of a water-based ingredient than an ointment, whereas an ointment tends to be thicker and more viscous, which affects how they're used with different skin conditions. A lot of times your ointments, they are thicker, they're more concentrated, and you're going to use a very small amount versus a cream. Another topical form is lotion. Lotion is a liquid preparation applied externally for the treatment of skin disorders. When applied, the lotion should be patted versus rubbed on the affected area because we don't want to rub and create more damage to that area. We can pat that on and that doesn't cause any damage to the layers of skin. A liniment is a preparation for external use that is rubbed on the skin as a counter irritant. Liniment creates a tingling or burning sensation to mask pain in the skin or muscles. So when it says counter irritant, it means against the irritation, and in this case, typically liniments are used for pain. Think of something like tiger's balm or capsaicin, something that is used on the muscles to provide that kind of tingling sensation, that kind of cooling sensation, sometimes warming sensation, depending on which type you're using, and that helps to kind of mask pain that is going on in the skin or muscles. And also a transdermal patch. Transdermal patches are skin patches containing drug molecules that can be absorbed through the skin at varying rates to promote a consistent blood level of the drug between application times. Transdermal patches vary in size, are easy to apply, and have long periods of effectiveness. So, going back to your objectives at the beginning of the chapter, the benefit of a transdermal patch is that they're very easy to apply, they last for a long time, and they give a consistent level versus, if I rub a cream on, maybe I'm trying to use a tablespoon of cream, but it's not evenly applied every time. A transdermal patch, it's going to sit there and it's going to slowly release that medication into the skin. Something like a lidocaine patch, this is something that you can get over the counter, but there are also pain patches that can be used to control chronic pain. There are things like nicotine patches to help combat addiction to nicotine, so on and so forth, and those are more of a consistent kind of release. Other preparations that are considered topical are those that are applied to mucosal membranes. So mucosal membranes are typically entry points into the body that have some kind of mucosal tissue. Mucosal tissue has built-in protection against the outside world via mucus. So things like your ears, your eyes, your nose, the rectum, vaginal canal, anywhere that's kind of an entry point into the body. So these types of preparations include ear and nose drops, eye drops, eye ointments, vaginal creams, rectal and vaginal suppositories, douche solutions, sublingual tablets, and buccal tablets. So sublingual tablets go under the tongue and dissolve right there on the mucosal tissue, and buccal tablets you press into the cheek and they dissolve in the cheek. Some are administered for local effect, and in other cases, some are for systemic effect. So local effect meaning it just works in that one area, and other cases used for systemic effect. Important to note that it does mention rectal suppositories, but there is also a whole category for rectal medications. So there's a little bit of crossover there, but the concept is the same, that it is interacting with this mucosal membrane, which is typically a very thin membrane, and it can be used either in just that area alone, depending on how it's being metabolized, or it can go into the body for overall effect. The following image on this slide illustrates a nitrodur transdermal system, and that is nitroglycerin patch. What nitroglycerin does is it helps to reduce the strain on the heart, especially during a heart attack. It helps to open up the blood vessels and allow more blood flow when there's a partial blockage. And nitroglycerin, there is a sublingual version, there is also a spray version. That goes orally, but it can also be used on a transdermal kind of patch like this, where it is just slowly absorbing through the skin in a sustained fashion for someone who's having a lot of oxygen demand on the heart, and that may need that for the time being to kind of open up those vessels while we wait for further intervention. There's an image after that, the bottom image, that illustrates topical drugs. Item A in this case illustrates a rectal suppository. It's again in that kind of metal foil looking casing, and when you open it, it looks like a wax bullet. And item B illustrates a vaginal suppository, and it's like a similar concept. It's in kind of this little metal package. It doesn't actually show that one opened, but it's the same kind of concept where it is placed in that area and then it can be absorbed or just stay on the mucosal membrane depending on what type of medication it is to treat either something locally or systemically. Another form of drug delivery is via implantable devices. Implantable devices are available in many shapes and sizes, and they are placed just below the skin near blood vessels where the medication can be readily absorbed into the bloodstream. So the most common example, I think in this case, is an infusion pump, typically used for type 1 diabetic patients. And we'll talk a little bit more about diabetes later in the semester, but type 1 diabetics, essentially, they need this kind of continuous insulin because their pancreas doesn't really produce insulin. Whereas type 2 diabetics, more so, they are resistant to insulin and maybe their body creates less, but they're still making some. Type 1, it is a lot harder to manage those stabilized blood sugar levels. And so a lot of times they will get these implantable devices that act almost as this mechanical pancreas to deliver that insulin to their body. Another type of implantable device is chemotherapy devices. Sometimes are implanted, little, radiation seeds or seeds that slowly release chemotherapy medications. Or birth control, the Nexplanon comes to mind. It is implanted into the arm and releases a steady stream of hormones to help prevent pregnancy. Last, there is the inhalation drug form. Inhalation drugs are fast-acting and effective for delivering humidification and medication directly into the respiratory system. The drug is usually placed in a device that will create a fine mist or aerosol containing tiny droplets of medication. It's rapidly absorbed in the respiratory system due to large surface volume area of the lungs and a vast supply of capillaries within that system. Inhaled drugs are dispensed through use of spray bottles, nebulizers, or meter dose inhalers. Inhalers is probably the most common thing that people think of, with asthma, where you shake it up, place it in the mouth, take a deep inhale, and those little particles are delivering medication to help open up the airway during an asthma attack. This slide has an image of an implantable device, in this case an insulin pump, that is on the abdomen, a few inches from the belly button. This is actually the best site for insulin absorption, so a lot of times folks who wear an insulin pump, that's around the area that they will wear it in. Knowledge check. Which has an administration form available in both lotion and transdermal patch? A. Nicoderm, B. Nitroglycerin, C. Tiazac, D. Duragesic. And we didn't specifically go over this, but the answer is B. Nitroglycerin. And I didn't mention it in the other slide when I was talking about sublingual and spray, but there is also a form of nitroglycerin that it comes out with a little sheet of paper that has like a measuring line on it, and the doctor will say, give them 1 inch or 1/2 inch of nitroglycerin, and you have this little packet that you cut the corner of and you spread along that line to get to the right amount. It's not as kind of long duration or consistent as a transdermal patch, and as you can imagine, some person's line might be a little bit thinner, one person's line might be a little bit thicker, so it's harder to deliver it as accurately, but it is something that is still commonly used, especially in an acute heart attack. Knowledge check. Which is an advantage of using a transdermal patch versus tablet or injection form? A. Length of effectiveness. B. Less costly. C. Requires a prescription. D. None of the above. And the answer is A. Length of effectiveness. Knowledge check. What is the second fastest acting route of drug delivery besides intravenous delivery? A. Lotion. B. Elixir. C. Inhaler. D. Transdermal patch. So remember, we are asking what is the second fastest acting route of drug delivery. IV is the fastest. The second fastest is inhaler. The pulmonary system is very vascular, and those inhaled droplets will very quickly begin to take action. So depending on what type of drug preparation you are doing, you will need supplies. Considering the variety of drug forms you may administer, it is critical to be familiar with the supplies that would be needed for drug administration. These supplies may include medicine cups. Generally, these are disposable and are used to dispense tablets, capsules, or oral liquid medication. If it's used for tablets or capsules, it doesn't have to be marked, but for oral liquid medication, you should be using a marked medicine cup that has measurement lines. Pill crushers or pill cutters. This provides the availability to break down medication. Sometimes you may need to split pills for reduced dose, so the order may say 0.5 tablets. You'll need to cut along the scored line. And then pill crushers, remember, not all pills can be crushed safely. So enteric coated cannot be crushed. Those extended release capsules should not be crushed. But if they are using a normal type of tablet that can be crushed, that's a great option for someone who has difficulty swallowing a larger pill. Ampule, so these are really going out of favor, but an ampule is a small glass container that holds a single dose of sterile solution for injection. So essentially the drug would be in this little glass bottle, and it has this thinner part where you have to break it. And if you are using an ampule, you have to hold it with gauze and then break it away from you just in case any glass comes free. And then when you're drawing it up into your sterile syringe, you have to use what's called a filter needle, because the filter needle makes sure that no tiny glass particles get into the medication that's going to go into the body. You can see why ampules are really going out of style, and you'll still see them sometimes at certain places, but a lot of times now it's preferable to have a glass bottle with a little metal top that has a rubber stopper that you use an alcohol swab, you clean it, and then you drop the medication. There's no risk of any glass getting into it if you use the newer kind of form of that. But you will see ampules sometimes. Vial, a container that holds powdered drugs to be reconstituted. So there are vials that hold liquid, and there are ones that hold powder. This is spelled wrong on this slide. I didn't create these. These were from the publisher, but VIAL, not VILE. Containers, again, that hold powder drugs or liquid drugs, vial. And then needles and syringes for use of injection. If you are drawing up a medication out of a vial or an ampule, you are not going to use that same needle to inject the patient. You need to use a filter needle or a blunt tip needle if you're using a vial that pulls up the medication, and then you replace it with the sharp needle in the size you need instead of drawing up with the sharp needle, because every time you access a vial with the little rubber top, you kind of dull the needle, and we want to use the sharpest needle possible for the patient so that there's one, less chance of it having been contaminated in any way, and two, it's a lot less painful. The Occupational Safety and Health Administration, OSHA, mandates that every effort be made to reduce the risk of needle stick injuries that could lead to bloodborne pathogen exposure. Therefore, OSHA recommends safety needles with a protected sheath that covers the needle automatically after administration, and needleless devices that can be used to access IV tubing for the administration of IV push medications. So what does that mean? In the past, they would draw up medications with a needle, and then that same needle would be used to access the IV line. So this OSHA mandate kind of led to these what we call lure locks. So you draw everything up, and let's say that you are then putting it into somebody's IV. There is a little kind of cap that perfectly matches the cap on the syringe, and you just screw the two together so that you're not taking that needle and pushing it into the IV line. Also, if you are ever pulling up a medication that requires a needle and you're going to carry it into the room and you need to keep the needle on it, you are going to place the cap on the table and kind of slide the needle in so that you're not holding the cap in one hand and pushing the needle in and potentially poking yourself. And the other thing that it means is that if you are giving an injection, like let's say a vaccine, an intramuscular injection, once you give that, there is this little plastic piece that when you pull it out, you click the plastic piece and it covers the needle. And that helps to, again, reduce that risk of bloodborne pathogen exposure or needle stick injury. Needle stick injury is a very big deal. If you get a needle stick injury in the profession, you do have to be monitored, and typically they will have to add some exposure panels to make sure that you weren't exposed to anything bloodborne such as HIV. So the following images on this slide, the one on top here, it shows medications given parenterally. including an ampule. So that's what I was talking about before. You'll see it has this kind of thinner neck on it. You have to snap that part off and use that filter needle to draw that up. B, a pre-measured sterile cartridge, so a medication that comes already pre-measured in the amount. And then C, a vial of powder for reconstitution. It's kind of hard to tell in the picture, but you would add sterile water or normal saline, whichever the order called for. It will tell you add 2.1 mLs of sterile water to create the final constitution. So you work with whatever the order says, and then you draw that all up. And then right here on the bottom, this is an injector pen. This is commonly used for insulin administration. That is kind of a pre-measured, or on the back there's this little dial, and so you will dial it to the number that you need after checking your blood sugar. Other medications that come in injector pens are like an EpiPen used for an allergic reaction, or weight loss medications such as Ozempic, that they have a dial on the back, and you are going to turn the dial to your dose, and then you inject it into the subcutaneous space. Knowledge check. Occupational Safety and Health Administration, OSHA, has mandated safety efforts to reduce the risk of needle stick that could lead to A, human immunodeficiency disease, HIV, B, hepatitis C, C, hepatitis B, D, all of the above. And the answer is D, all of the above. So hepatitis B and C, as well as HIV, are all things that we are at risk for if we have a needle stick injury, and that is why there have been some mandates that have come out to help protect healthcare workers. Self-assessment. Remember at the end of the chapters that we have these self-assessments to guide your studying and make sure that you got some of these key points. 1, can you explain the differences between common oral and rectal drug forms and when they may be used? 2, which type of injection is used primarily for allergy skin testing because of its slow absorption rate? And 3, give an example of a mucosal drug form. This has been Chapter 4 of Essentials of Pharmacology for Health Professions, 9th edition. Thanks for listening.